it's another show today. Yeah, and it's the last day in January. Are you excited? Like I'm excited. Welcome to another show. It's always a pleasure to have you. On behalf of Alps Hospitals and Diagnostics, I'd love to say a very big thank you to our dear viewers for always staying tuned to our broadcasts, to our shows. Really do appreciate you. I remain your host, Ruth Ogogo, and it's always a trailblazing experience to be here with you every Wednesday. From our last show, we talked about the traditional means of tightening the vagina, and we also talked about laser vaginal rejuvenation. Yes, and I know you gained a lot. For those that were not able to watch last week's show, yes, you can always go back to our page to watch it and get enlightened. Today, we'll be talking about platelet-rich plasma, which is another form of vaginal rejuvenation. That another thing that can be done to rejuvenate the vagina, and also we'll be looking at it together with laser vaginal rejuvenation. And to give details about this procedure, we have with us Dr. Kenneth Eguda. He's an IVF specialist, a consultant gynecologist, and a reproductive biologist. It's a pleasure to have you here. You're welcome, sir.
Thank you.
Yes, so as we get going, please feel free to drop your thoughts and your comments in our comment section. Yes, we'll attend to your questions duly. Please sit back and enjoy the show. So, yes, we might have someone that's watching the show for the first time, so it won't be out of place to still tell them what laser vaginal rejuvenation is.
Okay, yeah, it's actually a pleasure being with you on the show, and it's good to know that we're talking to quite a number of people out there. Laser vaginal rejuvenation, it's a procedure in which the vagina is renewed. You know, when I use the word renew, I mean it's tightened, so that the caliber goes back to the original dimensions, you know, that it's been, and then other functions of the vagina, like the lubrication function of the vagina, the sensual functions of the vagina, and even then are restored. Then for women who have a stress urinary incontinence, for instance, they also get restored, you know. So laser vaginal rejuvenation is a procedure in which laser is used and applied to the vagina itself, so that lost functions of the vagina or anatomical dysfunctions of the vagina are to a large extent corrected, you know. Yeah, so that's what laser vaginal rejuvenation is, as against just tightening, which is done surgically. That's just the skin of the vagina is reduced, and then you oppose the skin to make it tighter, but then the function of the vagina is still not restored, despite the surgical intervention that is done to tighten the vagina. So laser rejuvenation tightens the vagina and restore function of the vagina, the sexual functions, urinary functions, anatomical functions, lubrication functions, and even help in curing or in the treatment of recurrent vaginal infections.
So you, for someone watching, yes, you are just hearing laser vaginal rejuvenation. Yes, it does exist, and that's what we've been talking about. So yes, you can always go through our previous posts to watch and have good details of what laser vaginal rejuvenation is. So we'll also be talking very well today about platelet-rich plasma, which is another form of vaginal rejuvenation. So sir, please give us details on what this plasma, what exactly is this platelet-rich plasma that we're talking about?
Yeah, so you see the human blood, you know, has various components. You know, you have the red cells, and you have the other cells that are not red. So the platelets, the fibrin, and are the parts that are in the yellowish part of the blood when the blood is separated. When the blood is collected in a tube, for instance, and spun in a centrifuge, it gets separated. you have the red components going down,
Okay.
and then you have the yellowish component, you know, or the amber color component staying afloat.
Okay.
So by doing this, parts of the blood, the components of the blood are segregated. So the platelets actually stays in the part that is floating,
Okay.
in the colorless part, and that is what is used in medical therapy.
Okay.
So it is used for a whole lot of things. Okay,
Okay.
it's used to rejuvenate the ovaries.
Oh, wow.
For instance, women who are averse to egg donation and want to insist on using their eggs and are advanced in age and don't want to use egg donation, they could use that as a means of trying to achieve a pregnancy with their own eggs. It is used to rejuvenate the endometrial lining,
Okay.
because there are women whose uterine lining have issues. Maybe they adhere to themselves following gynecological procedure or whatever kind of procedure an individual has gone through.
Yes.
They adhere to themselves and then they form scars. You know, when they are separated and it's still difficult to achieve pregnancy, you could use this platelet-rich plasma, inject into the uterine cavity, into the uterine lining, you know, or instill into the uterine lining, and it helps healing and regrowth
Okay.
of healthy endometrial lining.
Wow.
It could just even be instilled into the uterine cavity during the process of IVF as a means of treating recurrent implantation failure.
Okay.
It could be used on chronic wounds that have refused to get healed.
Oh, wow.
You know, and then it helps healing. What it does is that it attracts stem cells
Okay.
to those aspects of the body where you have injected them.
Okay.
And what stem cells do is this: stem cells are naive cells, for instance, and they take up, you know, function of the site that you have injected them into. When you inject them into a site in the body, they become part of that part of the body and help informing or rejuvenating or reviving or restoring that part of the body. So that's what platelet-rich plasma does. So in a layman way of explaining it, you know, to the layman, they are like precursors to stem cells. They attract stem cells. So whenever you inject them, they tend to restore the function around those areas. So that's what the platelet-rich plasmas are, and that's what they are used for. They also used for beauty treatment.
Okay.
You know, to to help treat wrinkles,
Okay.
aging wrinkles on the face of humans and all of that. So there are quite a lot of use for platelet-rich plasma. And then in vaginal rejuvenation, for instance, when injected into the walls of the vagina, it helps to renew the wall of the vagina, to restore some anatomical and physiological function of the vagina. And so I guess that's why you're talking about addition of platelet-rich plasma to laser vaginal rejuvenation. When these two things are done pari passu or hand in hand, it heightens the effect of rejuvenation, of laser vaginal rejuvenation.
Okay, so someone that is watching, yes, in a short form we call it PRP, platelet-rich plasma. So yes, so when you hear PRP, in the should I say in the medical terms, yes, it could mean platelet-rich plasma. And like he has said, it could be used for various things, like he has mentioned. So for someone that might be undergoing a fertility treatment and you are bent on, this is just like saying, we're also recommending this for you. It could be done. So yes, you can always find all these rejuvenations done in Alps Hospitals. So we're talking about it now in relation with vaginal rejuvenation. Someone might be wondering, what's the benefits of using PRP? I mean, Lisa can just do the work, you know, so why should I use PRP?
Well, in the first place, the PRP itself, the platelet-rich plasma, could be used in rejuvenating the vagina without laser.
Okay.
Is that all you need to do is to get it prepared and instill it or inject it into the mucosa of the vagina. So it helps in growing the mucosa, improving the secretory functions of the glands, improve the glands, improve sensation. When injected into the G-spots, for instance, or into the clitoris, it heightens sexual sensation
Okay.
and orgasm.
Okay.
So
Wow.
it does a lot in the vagina, you understand? So it could to an extent also improve in the caliber of the vagina. For instance, when women have had a lot of vaginal deliveries, for instance, and the vagina is, this could be used and it improves function to a large extent. But now laser is excellent in all of this. You understand? It's excellent in all of this. Laser could drastically reduce the caliber, improve secretions, even help in treating scars in the vagina. For women who have gotten some cuts in the vagina and been repaired and developed scars, laser could be used to treat that. Then of course, urinary tract, urinary stress, incontinence. So when you add this, it's like a summation effect. When you add laser vaginal rejuvenation to platelet-rich plasma in the treatment of the health of the vagina, it's like you're having a summation effect. Okay. It improves the effect of laser, or laser improve the effect of they complement each other, and so it gives better effects. The effect lasts longer, you know, and well, I guess for anybody who assesses that kind of treatment, you could tell better what the effects are, because you're doing two things from the physiological perspective, using the human platelet-rich plasma, and also from the technological perspective, using the laser, which is a modern energy in gynecological practice. So they complement. I would rather prefer to use the word they have summation effects. Summation effects, like an accelerated effect of the benefit of vaginal rejuvenation.
Okay, so now someone might be wondering, how long does PRP, vaginal rejuvenation, take? You know, okay, you've said laser takes 10 to 15 minutes, and yes, if this is the time that PRP can be used, can the two be done the same time? For instance, somebody is just coming to the facility, I'm here for laser vaginal. Can the person say, okay, I want to do both laser and PRP together?
Yes, they can be done together. Okay. You know, the same sitting. The rejuvenation, for instance, using the PRP, the procedure itself of injecting, it doesn't take more than 2 minutes.
Okay. Oh, wow.
All they just need just to get the vaginal exposed using the speculum, and then you get it injected into the walls of the vagina. Okay. It's like giving local anesthesia. You know, just infiltrates the mucosa of the vagina with it, and then the effect, you know, it's beginning to be seen, I mean, in short time. Yes. After doing that, you could go ahead to do laser rejuvenation about the same time. Okay. You know, or you do them in a week's interval, you know. But then, just like every other medical procedure, we're not saying that laser, it's astronomical, give 100% of the effect. You know, medical procedures fail, you know, and sometimes you don't have all the benefits you need from even the laser, you know, and maybe you have a woman who had a laser vaginal tightening or rejuvenation and still complains of some deficiencies. You know, this may be a time to add on the platelet-rich plasma vaginal rejuvenation to it, so you have a summation effect. So the time to add, when to add, you know, is the decision of the gynecologist, which is also based on the complaint of the individual. But the two together, excellent effect, gives excellent effect. So
someone might be wondering, yes, so now you've heard him. Like we had said earlier in our previous videos, you could actually just use your break time to come and do it, and within 10 to 15 minutes everything is done. If you want to
just that for preparing the platelet-rich plasma itself, it may take like 45 minutes, 30 to 45 minutes in preparing it,
before the procedure.
In which case the woman's blood is taken, you know, and taken to the lab or wherever it is that the gadgets for preparations are, and get prepared. And then the injecting of the plasma, platelet-rich plasma, doesn't take more than 2 minutes. Yeah, and the laser vaginal rejuvenation is usually 10 to 15 minutes. You know, with no cuts, no surgery, no anesthesia. We've always said that. Just to insert the laser probe into the vagina, and then you have this in and out movement, because the fibers are usually radial fibers, so it dissipates the energy around the vagina, like, because the vagina is like a tube and it's also a tubular structure, so it dissipates the energy in and out the vagina, and then formation of collagen and elastin and the glands, tissues, and new blood vessels formation, and those are the things. These are the structures or the elements that renews the vagina.
So yes, you're watching, you've heard all these details, and a lot of people might be wondering, who are the people that you see? Okay, now this is where we cannot overrule the effect of assessment. That's where the gynecologist comes in. You don't just walk into the facility and say, I want to do this. Yes, of course, you might just walk in and say you want to do this, but the gynecologist has to evaluate you and then recommend him. That's why for some people now, they might just do one shot and everything is fine. For some, they might have to do more than once, up to 2-3 times before they see the effect. That's why it's not good that you compare yourself. Every individual have their different ways that they react to things. So do not compare yourself with other people, individual treatment. Just trust your gynecologist to recommend and do what is best for you. So people might be wondering, who are those people that you would recommend laser vaginal rejuvenation for?
You know, I have this opinion that people think that laser vaginal rejuvenation is just for those who want to improve their sexual life.
I also think so.
All right, so I think that's just a wrong impression. If we have given that impression, you know, then it means we've not communicated properly. Laser vaginal rejuvenation or tightening, it's not just about intercourse, about sexual intercourse. You know, when you look at women, for instance, who have given birth through the vagina, you know, and have all the trauma, all the cuts happening around the vagina, you know, and then somebody just complains he doesn't feel good being around there. You know, self-esteem is already affected here. So this rejuvenation helps to improve the woman's psyche and makes her feel she is still her old self and she's still desirable. That's one. Yes, the sexual aspect is there. Coitus or intercourse is improved, sensation and all of that. It's renewed. The husband feels happy, or the partner feels happy. She also feels happy. But then you have this old age woman who feels hot in the vagina without anything.
Yes.
You know, they bleed easily when somebody touches the vagina, you know, or have pain, I mean, during intercourse. Those are other aspects that laser vaginal rejuvenation cures, rather takes care of. Then you also have this group of women who leak urine. When they cough, they have a jet of urine. That's because estrogen is low, the pelvic floor muscles are weak, the urethra opening has been dislodged from its anatomical support, and so the sphincter that stops urine from flowing involuntarily is affected. Laser vaginal rejuvenation fixes that. And now these are all the things that happen to every woman as she's aging.
Yes, very true.
So it's something that every advanced age woman needs. Then you don't even have to be old to have some. There are young girls who also feel all of these symptoms, you know, have all of these symptoms, I mean, at very young age. They also need laser vaginal rejuvenation to improve the health of the vagina. You know, so quite a lot. Then you have the cystocele and rectocele, some having prolapse already. The early stages of prolapse. Laser vaginal rejuvenation fixes it, you know. So it's not just about sexual intercourse, it's just like 1/4 of what laser vaginal rejuvenation has to offer.
So for people that just give birth, is also recommended for?
Yes, that's the current recommendation, you know, that for post-vaginal birth rehabilitation, that is what it's called, you know, post-vaginal birth rehabilitation. Because no matter who you are, so long as you're a woman and you get pregnant, whether or not you deliver through the vagina is altered.
Yes.
It's altered. You know, I've listened to young boys or young guys who have come consulting with their partners and they say they don't feel crispy.
Wow.
You know, the vagina has its ruggeds, you know, the roughness, all the stretches of having a baby, 4 pounds, not 4 pounds, now 8 pounds baby or 10 pounds baby coming through that tiny tubular structure. It tears down the matrix of support. So women who have given birth by vagina especially, or those who even deliver by cesarean section, need post-delivery rehabilitation, and laser is the advice option worldwide currently.
So someone watching today, my take home is this. I don't know what your take home is, but I'm just going to tell you my take home. Now, laser vaginal rejuvenation or PRP, it's not just for sexual pleasure. Yes, that is part of it, but it also corrects a lot, reduces pain for the people that have pain, those people that are aged. Yes, it makes the place not, because the friction causes pain. Some people might even bleed, so yes, it reduces all of that. So if not for anything, let's say maybe you say, I'm not the sex person, but at least for your comfort alone, the comfort that you would derive when you go through this, at least for that comfort alone, it's recommended that you actually go for laser vaginal rejuvenation. So as we gradually come to an end of the show, I want you to give a counsel to those viewers. Yes, what's your counsel to them with regards to the topic we talked about today?
I think the laser vaginal rejuvenation or the PRP rejuvenation or PRP summation on the laser vaginal rejuvenation, it's a move to improve on the feminine life.
Yes.
On the feminine life. I think for a woman, one of the things I know the women protect a lot is their privacy. They call it privacy, and that is the perineum. We in gynecology will call it the perineal area, the vagina and all of that. So laser vaginal rejuvenation, which is a non-surgical treatment of lots of abnormalities in the vagina, helps to improve the feminine life. It tightens the vagina, improves sexual intercourse, improves vagina health, improves urinary stress incontinence or stress urinary incontinence, treats some level of cystocele and rectocele, and even recurrent yeast or candida infection. So I think women should take good advantage of this wherever they find the services being offered, and get the benefit from it. It's not all about intercourse. It's about igniting and renewing the feminine life, and make yourself comfortable down there.
And also to boost your confidence. So for someone watching, please boost your confidence with laser vaginal rejuvenation or in conjunction with PRP. So it's been wonderful having the show today, and it's been very amazing having you, our viewers. Stay tuned with us as we went through the show. So you've gotten all you need to get for today. Until we'll come your way next time on A Day with Your Fertility Specialist, please continue to like our post, continue to share with your loved ones. Yes, if you have someone that didn't join us, please share the link with them so they could actually watch the re-upload and also have the knowledge that you've had. And it's not just to have knowledge, you act on what you've actually heard. Yes, act on it and recommend it to someone. Thank you for watching and for listening. Bye.